Namaskar, I am Dr. Garg. Today we are going to explain you how the hair transplant is being planned, why do you need hair transplant, and what are the important points you should know, and when the hair transplant looks poor and when it looks great. First of all, I'll explain you what is the problem in hair transplant. If your high grade of baldness means the baldness from here to here, then normally before losing hair you had 30,000 grafts. So we can say the demand to cover the entire bald area of the scalp is 30,000 grafts. But we cannot bring this much because the supply is limited. So when the supply is limited and demand is unlimited, then whatever you have, you must utilize them intelligently, artistically, scientifically, so that you can see more natural, aesthetic appearance and good coverage of your scalp and reasonable density. So let's go. This is the man. During 25 years of his age, he was like this, very happy. You can see his face looks balanced, but what happens, he aged, then he lost hair and he is not happy. You can see his sad look and he is not looking so good, although his face and everything is normal, his structure is normal. What happened? His anterior hairline got receded. So what it makes the difference? The beauty lies in the eyes of beholder is not true. Beauty lies absolutely in the mathematics, and the face has got proportion, fixed proportion of 1/3 and 1/3, and you want to become like this again. And here's the role of hair transplant surgeon, to make you again the same as you were during your young age. So as I was explaining, the face looks beautiful because it maintains the aesthetic proportion from one part to another part, and you see what has happened here. This portion has receded hairline, and 1/3, and it becomes broader. So if it becomes broader, then this is not maintaining, so it's not looking good. And now what hair transplant surgeon is that he has to bring it back and put it here, so the proportion is restored. Now see, this we have to put hairline here, and that was done in this case. So the proportion, to maintain the proportion of the face, you need hair transplant or to replace your hairline where it was. Now the planning. This is the planning which we did. This is the hairline. This is the temporal area. This is the anti-hairline zone. And this is the total scalp planning. This is the frontal area. This is the mid-scalp area, hairline, forelock, and the temporal region. We are planning 5,000 grafts in this region. Now temple, this is little different. I am talking is this is the area which normally you don't look at it, but this is one of the most important aesthetic area which needs to be reconstructed. Here you can see this got receded. You can see here the anterior hairline frame the vertical framing of the face, while the temporal area does the horizontal framing of the face, and both are important. That's why we are making this temporal area and the anterior hairline for the perfect framing of the face. And these are the temporal area, although you can see here is the quite sharp, but when the hair grows, it doesn't look so sharp, which you have seen. This is the planning. This where we did the transplant. This is the anterior region, we have done it. And now we go on the anterior hairline where the most of the mistakes are done. Hairline is not a line, it's a zone. And these zones, if you look at yourself or just see your son and just make this hair comb posteriorly backside, you will see the hairs are irregular, thin, and they are in some irregular fashion, serpentine fashion. That's how they look. So it's not a line, and many times when the patient comes to us, they ask, sir, don't make a straight line because it looks unnatural, and that is a problem with the wig. Huh? Now this is the anterior hairline. You can see here, we have put some hair here. These are the triangles. These we call them clusters, and these are the sentinel hair to make hairline, not like a line, but it's a zone. And you can see now, it's not sharp. It's looking absolutely aesthetic. And this is the temporal area we reconstructed. Here you can see his face looks balanced from here to here and from here to here, and similarly on the another side his face looks balanced. And on the top side, if you see, and these are the 5,000 grafts which were taken from the scalp. We take 3,000 grafts from the back side of the scalp, 2,000 grafts from the beard on the next day. The entire surgery is done in 2 days. One day morning 9 o'clock patient comes, 6-7 o'clock goes home. During this entire period he is totally awake. He is given lunch, he enjoys tea, coffee, and he watches the movie also. Then in the evening he goes back, next day morning he comes back, and again we extract the beard and then implant them. This is the entire picture you can see. From here to here, here to here, here to here. Now this is a perfect. So this is the planning how we make. If you are advanced grade of baldness, then you need more number of hair. Beard, chest and abdomen are extra scalp, good donor area. If you have, it's a good. Now the question may be in your mind that if you have white hair, then yes, we can implant the white hair also. You can dye them, they are naturally, you can cut them also. And they are different than the scalp. Yes, they are different, but over the period they become better, and there are many other things to manage them so that they look natural. Another thing, if we have devised a technique, the combination grafting, which we have developed at Rejuvenate Hair Transplant Centre, which has been published. You can see we make a combination of scalp and beard hair in such a way that they don't look unnatural, and you can appreciate here. Thank you. If you have any question, please give us a call. Thank you very much.